Hi, my name is Dr. Damree and I am very honored to be presenting at the 43rd annual meeting of the Japanese Society of Aesthetic Plastic Surgery in Tokyo. I will be presenting on behalf of ExoCoBio about the clinical applications of exosomes in minimally invasive hair restoration and in cosmetic dermatology. This is my medical disclaimer. I am the director of ExoEvo UK Limited and we are the exclusive distributor for exosome products from ExoCoBio. I am also the clinic director of the London Exosome Clinic. Being an aesthetic medical practitioner, I have a particular focus on bringing innovative biotechnology and medical devices in the field of anti-aging and cosmetic dermatology from South Korea to the UK. I am now going to share some projects of the London Exosome Clinics. In 2020, we have successfully opened 2 clinics in the centre of London, in Harley Street and in High Street, Kensington. And our plan for this year would be to integrate the London Exosome Clinic in the Wood Private Plastic Surgery Hospital in the south of England and to build another clinic in Birmingham. Exosome is the rising star in regenerative medicine. There has been a 5-fold increase in the number of searches about exosomes in Google Trends in the last 15 years. These are the industry advances that has happened over the last decade about exosomes. There has been a sharp increase in the number of research and scientific papers that have been published since 2008. The amount of research and development that has been put into exosomes on a global market has led to an increase in the number of papers published, an increase in the number of patents that have been issued, an increase in the number of companies specializing in exosome manufacturing, and also an increase in the number of investment and venture capital funds that has been injected into this sector. Exosomes have been successfully used last year during the COVID-19 pandemic. As we all know, the COVID-19 disease progression involves a cytokine storm that leads to acute respiratory distress syndrome. This viral sepsis can lead to significant hypertension and eventually multi-organ failure. The aims of treatment in COVID-19 involves a combination therapy of anti-inflammatory properties, regeneration of tissue, and an antiviral therapy. Chimera Lab in the USA has successfully used IV exosomes to increase the blood saturation of oxygen by up to 2.5 times within only 12 hours. And this had been a successful treatment in reducing the cytokine storm of COVID-19. This slide depicts the superiority of ASC HLRV versus other treatment modalities used in the field of regenerative aesthetics and specifically to minimally invasive hair restoration. The use of nanofat grafting has been prominent in the European and UK market amongst the hair transplant clinics. Nanofat grafting has been used in combination with or without PRP to help hair regrowth, to increase hair density and also hair thickness. However, ASC HLRV is far superior than any other modalities listed in the table here. ASC HLRV exosomes are safe in that they are cell-free and do not contain any DNA. They are ultra-pure due to the ExoScript patented double filtration process of ExoCoBio. They are easy to use because they are an off-the-shelf product which has a high quality control. They are highly stable due to their double bilipid membrane, and they are superior in efficacy because of the numerous thousands of functional microRNAs and growth factors present within the product. This leads to a significant anti-inflammatory and regenerative potential of the product. Furthermore, there is no downtime, as it is a minimally invasive product to use, and it is also cost effective. I will be now presenting to you about the clinical applications of ASCE HLRV in minimally invasive hair restoration.
Hi, I'm Dr. Damree and welcome to the London Exosome Clinic. We are the sole exclusive distributor for exosome-based products in the UK. We are specialized in the use of exosome manufactured by ExoCoBio, namely ASCE HLRV and ASCE SLRV, for minimally invasive hair restoration and skin rejuvenation. I will be demonstrating to you the DDIP protocol step by step today. Step 1 of the DDIP protocol involves the use of a chemical peel. So today I'm using mesopeel that contains 10% glycolic acid. So what we will be doing is applying the mesopeel onto the scalp for the descaling of the scalp. Alternatively, we can use a mechanical exfoliator. I am now demonstrating the application of the mesopeel onto the scalp. Apply the mesopeel evenly on the scalp, directly on the scalp onto the area that needs to be treated. The mesopeel has been left on the scalp for a period of 3 minutes, and now using lukewarm water, we are going to remove the mesopeel onto the scalp. Step 2 of the DDIP protocol involves the use of Febuary, which is a microneedling RF device. The tip of the Febuary comprises of 36 gold-plated needles. The machine has been calibrated to the specific settings for hair restoration, and I will now demonstrate to you how to use the device on the scalp. This is ASCE HLRV, a product from ExoCoBio. It comes in this pack and it comprises of 5 vials. So this is one of the vials containing 10 billion exosomes, and it is vacuum packed. So we're going to uncap it, removing the lid only, and be mixing it with 3 mils, in this instance, of lignocaine. So we have a draw-up needle and we'll be drawing up 3 mils of lignocaine. Alternatively, you can use normal saline or PRP. Afterwards, we shake the vial so that the lyophilized powder is completely dissolved, and it dissolves very easily. We draw up the exosome solution. And here I am using a nano needle, which is 33 gauge, 4mm depth, to inject the exosome. And now it's ready for injection. I will now be demonstrating the point-by-point technique of injection of the exosome into the scalp, and this is done at a depth of 2 millimeters. of exosome solution that is left on the scalp, please massage gently to increase absorption of exosomes. The final step of the DDIP protocols involves the use of low-level light therapy. Here we are using level light medical device, and we will be using a mixture of red and infrared light. The duration of the treatment is for 20 minutes. The maintenance therapy to be used along with the DDIP protocol involves the use of stem cell-based hair serum that can be applied twice daily, and also a hair regrowth shampoo that can be used up to 3 to 4 times per week. The patient uses this at home throughout the 3 to 6 months period.
I will now be introducing the Dr. Damree Innovative Protocol DDIP to you. In this protocol, we use a combination of microneedling RF and exosomes. I would like to highlight the benefits of the microneedling RF device. In the first instance, the radio frequency itself induces the production of cytokines and growth factors, which is associated with hair growth. And furthermore, the microneedling induces microtrauma to the scalp. It triggers the production of growth factors and helps and induces hair growth. For this particular protocol, the specific settings for hair restorations are to use a radio frequency at a level of 2 Hz at 100 milliseconds, and the ultrafine needles are going to a depth of 0.8 millimeters. The advantages of the DDIP protocol is that we are using the synergistic effect of the microneedling RF along with the exosomes. So we recommend to have in between 6 to 8 sessions of microneedling at 2 weeks interval in combination with the exosomes. I will now be presenting some of my clinical cases to you. The first case is a 28-year-old male who presented with androgenic alopecia, having had a history of hair transplant surgery 8 years ago in India in the crown area. At the time that I saw him, he had significant hair loss. We adopted the DDIP protocol at 2 weeks interval along with low-level light therapy. The results that were obtained were an increase in hair growth, increased hair density, and increased hair thickness in the crown area. This is depicted in the before and the after photographs. This case about minimally invasive hair restoration was performed in the USA by Pure Vanity Spa. Exosomes were used in combination with MTS and low-level light therapy at an interval of 1 month. As you can see in the photograph, a superior hair restoration was obtained. Exosomes can also be used in the field of cosmetic dermatology. I will now be presenting the clinical applications of ASC SLRV, which contains 5 billion exosomes and is manufactured by ExoCoBio. Exosomes can be used in the field of cosmetic dermatology. Exosomes can be used for anti-aging purposes, anti-inflammatory purposes, and to reconstruct the skin barrier. I will now be demonstrating a few clinical cases that I have performed in my clinic where we have used ASC SLRV to treat a number of different dermatological skin conditions. The first case is a 55-year-old lady who presented with global signs of aging. The DDIP protocol was adopted, whereby we perform 4 sessions of combination microneedling RF with exosomes. The results that were achieved were skin rejuvenation, skin tightening, lightening of the skin, increased skin radiance, and pigment correction. And this is clearly demonstrated in the before and after pictures. I will now be presenting these 3 cases that have been performed in the US to address skin rejuvenation and anti-aging. The first case was performed by Dr. Yin, whereby a combination of exosomes was used with microneedling RF with a view of treating periorbital wrinkles. The second case was performed by Dr. McAvoy, whereby exosomes were applied after plasma laser therapy for skin rejuvenation over the entire face and neck. And the third case, a similar technique has been used with exosome and combination of plasma laser treatment. Exosomes can also be used to promote wound healing, and this is especially important in the field of aesthetic plastic surgery. This is a complex case that I will be talking to you about, whereby a 57-year-old lady with mid-face trauma post a bicycle handlebar accident presented to the clinic. The diagnosis at the time was a mid-face laceration with significant loss of skin and facial adipose tissue. The aims of the treatment were to treat the facial trauma, minimize potential scarring, correct the pigmentation in her mid-face, and to reduce the overall skin laxity. The DDIP protocol was adopted with 4 sessions of microneedling RF along with injection of exosomes into the area of facial trauma. The results that were obtained were rapid wound healing, correction of the facial defect, minimization of scarring, correction of the pigmentation, and skin tightening. The photographs depicts the results that she's had, and the patient was very satisfied with the end result. This is a case performed by a plastic surgeon in the USA, whereby they have used a combination of exosome and erbium YAG laser for full face resurfacing for anti-aging purposes. As we can see clearly in the photograph, only after 5 days after the erbium YAG laser, there was significant reduction in erythema, and the skin had already started to heal at a much faster rate compared to a normal process. Exosomes have also been proven to be very good in cases of acne scarring. This case demonstrates the use of exosomes in combination with microneedling RF to target acne scarring on the face. There was significant improvement in, first of all, in treating the acne, in the skin texture, and in pore tightening. One of the latest clinical studies that has been published in the Journal of Cosmetics is the effect of exosomes on skin brightening. Hence, we can effectively treat melasma, which is a very difficult condition to treat, with ASC SLRV. This 37-year-old lady presented to my clinic and with a 5-year history of recalcitrant melasma that was non-responsive to any other medical treatments. 5 sessions of exosome were injected point by point at a depth of 2 millimeters. The results were that there was a downregulation of melanocytes leading to the correction of hyperpigmentation. As you can see in the photographs, overall she's had the skin brightening, and along with that, her melasma was treated. ASC SLRV has significant anti-inflammatory effects, and this is the clinical study that proves it. This 33-year-old man with folliculitis barbae that was recalcitrant to antibiotics and Roaccutane treatment presented to my practice. We treated him with 4 sessions of exosomes that was injected at 2 millimeters depth. There was a significant reduction in the formation of pustules. His skin had brightened, and overall his skin health had improved significantly. Rosacea is a very difficult condition to treat and impacts significantly on a patient's quality of life. This patient suffered from rosacea on the nose. For the treatment that he has had is topical application of exosomes on a daily basis for 4 weeks, and to gently massage the exosomes into the nose. And as we can see in the photographs, the rosacea was successfully treated after 4 weeks. ASC SLRV can also be used to treat atopic dermatitis because it has been proven that it helps in the reconstruction of the skin barrier. For the first time in the world, and as it was published in the journal Cells, ASC exosomes were proved to increase the amount of key lipids such as ceramides and dihydroceramides. And this is demonstrated by this clinical study. This 21-year-old male with a 4-year history of facial atopic dermatitis presented to my clinic following failed treatment with steroids. 3 sessions of point-by-point injection of exosomes into the area of facial dermatitis were performed. As you can see, there was resolution of atopic dermatitis with skin barrier reconstruction. The itchiness has resolved, and the areas of skin hyperpigmentation were also improved. Of note, which is very interesting, to date there's been no recurrence of the area of facial eczema on his face. Exosomes can also be used to treat contact dermatitis. This is a 36-year-old male car mechanic with a 10-year history of contact dermatitis to vehicle oils and fluids. We performed a combination therapy of 1 session of nitrogen-argon plasma gas with injection of exosomes. As outlined in the photograph, the skin barrier was repaired. There was resolution of the skin irritation and redness. Lastly, in my clinical experience, I have used exosomes to treat neurodermatitis of the anogenital area. This 55-year-old lady with 15 years history of lichen simplex chronicus of the anogenital area presented to the clinic. She had failed steroid therapy. 4 sessions of retrograde linear injection at a depth of 2 millimeters were performed. There was reduction in the itchiness, re-epithelialization of the skin, progressive resolution of the LSC, with significant improvement in her quality of life. With my clinical experience having used the exosome products manufactured by ExoCoBio, I can confidently say that exosomes are the next generation regenerative therapeutics. They are superior in their efficacy and safety to be used in the field of hair restoration, skin rejuvenation, wound healing, and other dermatological conditions. This is because of the innovative biotechnology with patented filtration process of ExoCoBio. Furthermore, the proven clinical results speak for themselves. We should furthermore embrace the use of exosomes in combination with medical devices so that we get the synergistic effect that we are looking for. Thank you very much for your time and your kind attention. We look forward to working with you in the future. Arigato gozaimashita.